So I'm going to be speaking to you today about meningitis, and meningitis is important for NCLEX board exam. First of all, what is meningitis? So it is the inflammation of the meninges, right? This inflammation occurs because of bacterial infection or viral infection. If we go and see this picture, the brain tissue is covered by a layer which is called meninges. The meninges have three layers: arachnoid matter, subarachnoid matter, and pia matter. Pia matter is the most inner. This is the normal pia matter, but it is the inflamed one. So if anybody have meningitis and if we collect the cerebrospinal fluid, the cerebrospinal fluid will be milky appearance, right? So next here, it is the inflammation of arachnoid and pia matter of the brain and spinal cord. It is characterized by bacterial or viral organism. Although fungal or protozoal meningitis have, but I can tell you the viral meningitis is the most common, and it is resolved without treatment. Bacterial meningitis is contagious and with a high mortality rate. So predisposing factor including the skull fracture, brain or spinal surgery, sinus or upper respiratory infection, the use of nasal spray, or individual with a compromised immune system. So this is the risk factor to develop inflammation of meninges. We called meningitis. How we can prevent it? So immunization helps to prevent bacterial meningitis. NCLEX boards usually asks a question: when students go to the dormitory and vaccine is given to the student when they living in dorms. So CSF is analyzed to determine the diagnosis and type of meningitis. In meningitis, the CSF is cloudy with increase the protein and increase the white blood cell and decrease the glucose count. So if you analyze the cerebrospinal fluid or CSF, if the underlying cause of bacteria, we will see the cloudy CSF if it is bacteria. But if it is viral, it will be clear, not cloudy, and decrease the glucose content, but increase protein. So a common question NCLEX board asks, how we have to make sure it is CSF or not? If we count the glucose, we see that decrease the glucose content in CSF, but elevated white blood cell or WBC because it is an infection, and also elevated the protein, total protein increase. And elevated WBC and elevated protein for both type, virus or bacterial, both. What next? Next here, the transmission. How it is transmitted. So meningitis is transmitted by direct contact or droplet. So if I ask you how it is transmitted, what kind of precursor we need? Contact precursor or droplet precursor? Because they spread direct contact or droplet. So what are the sign and symptom of meningitis or data collection? In this picture, you can see the early sign of meningitis and feeling the macular and papular rash. Right? This is the small rash, macule or papule. Some patient called about the photophobia. They does not tolerate that sunlight, or level of consciousness reduce. Or we can see the knuckle rigidity. So the neck rigidity we call knuckle rigidity. Some patient complain headache, photophobia, nausea, vomiting, and we found positive chronic sign and positive Brudzinski sign. And also I said fever and level of consciousness will be altered, tachycardia, and in the late stage seizure, red and macular rash with meningococcal meningitis. Here showing two signs, chronic sign and Brudzinski sign. Chronic sign started by K and knee started by K. So if knee is flexed to the 90 degree, hip is flexed to 90 degree, your one hand over the knee and another hand just behind the tendo-Achilles. If patient extend the knee, it would be painful. So extension of the knee is painful or limited the extension. It means chronic sign positive. And Brudzinski sign, patient elicit the hip and knee flex. And if you tell them to touch their chest over the chin, it would be painful. And it indicate the passive, it indicate the Brudzinski sign positive, right? So a NCLEX board asks a common question frequently due to some unknown reason. So what meningitis, during the meninges, what are the most prominent sign? It is increase the intracranial pressure. So pressure inside the brain or intracranial pressure will be increased. When intracranial pressure increase, we can see the patient blood pressure increase, then patient pulse will be reduced, respiratory rate will be reduced, but temperature will be increased, right? So to increase, to reduce. Blood pressure increase, body temperature increase, but pulse rate reduce, respiratory rate reduce. So what are the nursing intervention? So as a RN or LPN, we monitor the level of consciousness, we monitor the vital sign, we initiate the seizure precursor, also maintaining the isolation because it is the contact precursor, it is droplet precursor, and also elevate the head of the bed. It is important. And let me read it first. Monitor the vital sign and neurological sign, if any, and also monitor for the sign of intracranial pressure. What are the signs of increased intracranial pressure? This one, right? The 4 vital sign, blood pressure, pulse rate, respiratory rate. We have to take the initiate for seizure precursor because it is the safety is the most priorities. Also, monitor for the seizure activities, monitor for the sign of meningeal irritation, assist to perform cranial nerve assessment, check the peripheral vascular status, monitor isolation precursor as necessary with bacterial meningitis. What next? Maintain the respiratory isolation for the client with pneumococcal meningitis. Elevate the head of the bed 30 degrees and avoid the neck flexion and also extreme hip flexion. Prevent the stimulation and also restrict the visitor. Admin analgesic for the pain and also antibiotic. So what are the medication are prescribed? Antibiotic and analgesic. So nursing care is very important here. So in this picture, little bit review about the sign and symptom of meningitis. The first picture we can see temperature is increased, right? Chill, don't like the light means photophobia, pain start, drowsiness, skin rash, and headache. This is the most common sign. If you want to add, another sign is knuckle rigidity, means neck rigidity, or Karnick sign positive or Brudzinski sign positive, and altered the level of consciousness. In case of meningitis, the nursing care is most important. So droplet precursor until antibiotic are administered for 24 hours. So it is very important to isolate the patient. Quiet room, low light, head of the bed should be 30 degrees, and we monitor, increase the intracranial pressure. And we instruct the patient to avoid coughing or avoid the sneezing. Also implement seizure precursor. And some treatment, I said, if the bacterial, we give antibiotics or anticonvulsant. like phenytoin and analgesic. That is more than enough for meningitis for NCLEX board exam.